And Travis, is the recorder on? Yeah, is it? Okay. Let me get us going here.
What's the best way to get into the queue with you? Text, wave?
Wave or text? Either one. Wave or text. Yeah. Okay, I think we are going to get started. Okay, welcome everyone. I'm calling to order this meeting of the Assembly Housing and Homeless Committee. It is Wednesday, May 21st at noon. Let's go ahead and just go around and make sure we know who's here for members. You want to start?
Yarrow Silvers.
Daniel Voland.
Zach Johnson.
And it's Cameron Perez Verdia. Doesn't look like we have anybody on the phone at this point. And just as a reminder, to get in the queue, you can either send me a text or you can wave your hand or do whatever you need to do to get my attention, and I'll add you to the queue. We have a number of presentations today, and just the strategic priorities piece. Are you going to do that one, or do we want you are? Okay, great. Great. Let's just jump right in and get started. If you'd like to introduce yourself for the record, then we can start.
Good afternoon, everyone. I'm Thea Agnew-Benben, one of the special assistants to Mayor LaFrance. Unfortunately, Farina is not able to attend today, so I'm going to provide the update on our priorities and a little bit about designated parking, and then move into the micro units presentation. We've had some press over the last couple of weeks. The mayor had a press conference last week and really outlined our approach to homelessness and focused on 5 main areas: abatement, enforcement, crisis care, shelter, and housing. I just wanted to provide just some really
Can you go through those one more time?
Yep.
I want to make sure I got them.
Abatement,
Mm-hmm.
enforcement,
Mm-hmm.
crisis care, shelter, and housing.
Thank you.
So I just thought I'd give a very brief update in those areas.
Great.
So on abatement, there's still a lot going on. We just recently were able to move forward with the abatement of a camp at Lois between Northern Lights and Benson. It's actually happening right now. It's where Farina is. And we were able to do outreach prior to that and help a number of those folks relocate. And so that abatement should be completed this week. That was one of the camps that's on a DOT right-of-way. So it took us some time to get their permission to move forward, but we gained that and we're able to move forward with that. We will have a few others coming up, but we don't have any specific ones that we can announce right now. And then we are very actively doing outreach at Davis Park and the snow dump, again, with the goal of abating that large camp in the early summer. And those outreach efforts are bearing fruit every day. We're having people move into shelter, into treatment. This is coinciding with the funding that we have available for emergency rental assistance. So that's really helping us move some people out of shelter, make room in shelter, and kind of keep the flow going. And maybe I'll just pop to housing for a second because that's what the rental assistance is for. We do have 6 grantees of the health department. The health department's very actively managing and coordinating those, distributing $5.5 million in rental assistance. And so that is active and happening. There's information about that on the health department website. And you can also go to the coalition or any of the other grantees, which are United Way, NeighborWorks, New Life Development, and Choosing Our Roots. And all of that's on the health department webpage. So that's very exciting. We also have some active RFPs for housing, CDBG money getting decided. So you should be seeing that before the assembly in the next, I would say, 4 to 6 weeks for some more affordable housing development. Going back up to enforcement and crisis care, we also had a press conference yesterday. The mayor spoke to our public safety priorities and gave an update around enforcement and the municipal prosecutor's office. And then we really focused on crisis care. We're starting a pilot project over the next 3 months where we'll be adding an additional few shifts of the mobile crisis team and having them do outreach as well as be dispatched. Because what we're finding is that when they're 100% dispatched, they don't necessarily get to people who are in the community experiencing crisis, but nobody's picking up the phone and calling for them. So they will be going and doing outreach, similar approach to how the Hope team is doing outreach, although not only to people who are experiencing homelessness, just people who may need assistance, but there isn't anyone picking up the phone for them. So we'll be doing that over the next 3 months and seeing what we learn and adapting from there. We also are going to be deploying our safety patrol vans a little bit differently. You might see them in more focused areas. We're going to focus around downtown, Midtown, in Mountain View, along Spenard Road. So having them do a little bit more focused engagement in certain areas where we have a lot of high traffic. We are working on designated parking. So that is going to go out as an RFP. We were trying to do it as an ITB to make it a bit quicker, but realized that we need more information than we can feasibly do in an ITB. So health department and our office are working on a RFP process that should be going out soon. We have a couple of good locations that we've identified that are in municipal control. So we feel like once we have the operator, we'll be ready to get going on that. And then another email that you got probably just yesterday was an update on warming, because there was a request made when you extended warming till June 30th that we provide some additional data. So that's that data has been provided there. And happy to answer questions, but I won't go through it unless you want to.
I have some questions too, but you want to start? Ms. Silvers?
What are those parking locations that you identified?
One of them is, oh, you can't hear me, huh? Oh. Okay, let me try this. Is that any better? Okay,
I'll ask again with my
Okay.
mic on.
okay.
What are those parking locations that you've identified?
Yeah, so one
Thanks.
of them is an area that it's a municipal right of way that's undeveloped. So it's in an industrial area. It's a part of Cordova Street, but it's closer to like 100th. And so it's an area that already has a gate. It seems like a really good spot for it. So we haven't like completely confirmed that, but that's the one that seems promising so far. And then what is the second one? That one I think is more TBD because I can't call it to mind right now. But that will all be outlined for you when this actually comes before you.
Mr. Volant?
Thank you. I appreciate this update and all the work that you guys are doing. What's the expectation of how that would be operated? The designated parking spaces and like what level of sort of facilities or support? Yeah.
So through the chair, Member Bolland, it'll be a nighttime service, only in the warmer months. So probably like 5 to 6 months a year. And people will have to have a permit to use it. So they'll have to show that they have license and registration. Their vehicle will have to be in working order. And then it will be a place where you can park. There will be the sanitation facilities available and a place for garbage and security. Yeah.
I have just a couple questions on the first, the strategic priorities. In terms of communication around abatement, is there an intention to what is the sort of a plan in terms of communication around what's been abated, what's going to be abated? How does the public sort of make sure that there's a lot of awareness around that?
Great question. We actually just met with Mike Knapp at GIS yesterday, and because we realized that there was kind of a gap in the information sharing on our map. The map is the best way to know what's been reported, so that's working great. It also tells you what's been cleaned and where outreach has gone. But what we realized was it wasn't doing a great job of telling you what we had recently abated. So that's now going to be fixed. So the map is probably the best way to get kind of up to the minute information. That's where we get information from in terms of knowing what locations have been reported, as well as we get public safety data and other things that help us prioritize according to code. And that's the best way for us to report back in terms of keeping people up to date on all the different locations that they've identified.
Great. And then on the designated parking, are you going to require any action by the assembly related to that? Anything in terms of allocation of funding or policy changes of any
I
kind?
believe the contract will come before you. Yeah, the contract will come before you.
Okay, great.
Yeah.
So we can
I
look
think the
forward to
funding
it.
is already budgeted.
Okay. Okay.
Yeah.
Yes. Ms. Baldwin-Day.
Thank you. Just a follow-up question about the GIS. What has been reported and what's been cleaned already exists. So what will be added is what is currently being abated. Like that's the information that will be added.
Just that it's supposed to be on there. It just wasn't working properly. So it'll just show you now where we've abated.
Oh,
and-
where what has been
Yeah,
abated?
yeah,
Okay.
yeah.
Is there any plan or option to add, some sort of like general, here's what is prioritized for abatement, or here's where we think abatement will occur next, just so that members of the public can sort of see what sort of triage is happening as well?
Yeah. Through the chair. I think that's a super valid request. It's a little hard to meet that request because what we find is we're using the characteristics in code in order to do that prioritization, but things do change week to week. So for example, one recent example is we found out that we had some really significant bear activity happening in a location. So that means that instead of doing the one that was kind of top of the list, we're going to move to that one sooner. So, and similar things happen when we have violence against individuals or other types of activity that, put something else to the top of the list. So we do meet every week and review all that data together with all the different departments that are involved. And that's really where those decisions are made. And then it goes through the process that's designated by code to get all of the different sign-offs and create the legal notice. And so I think it's probably best just to look on the map and see where things are being prioritized and to kind of know what uses we're prioritizing. It's harder to give a more specific answer than that. Yeah.
And we've been joined, by the way, on the phone by members Gecker, Brawley, and Constant. Mr. Constant, do you have a question?
Kind of a comment on the last request. I can't speak to the administration's take on this now, but over the last many years, there have been a number of other reasons why you wouldn't put areas you're prioritizing for abatement, including safety for people, because oftentimes those kinds of tools have been used for targeting.
Yep, that's very true. Thanks for sharing. Thanks for adding that.
Sure. Mr. Volland?
I think what might work is if you could add ones that have been noticed for abatement on like the 10-day timeline or however long.
Thanks. And actually that may be one of the things that we added. So I'll double check and get back to you on that.
Great. Okay, we're through the first two bullets, and if no other questions, we can move on to the presentation on micro units. And just, can you give us a clarification of, in terms of, you're giving this presentation in preparation for a request by the assembly. Can you share that with us first, and then you can start your presentation?
Yep. Chair, before I do that, can I give one other
Oh,
update
sure.
on
Yeah,
shelter?
please.
So we have been planning to have to be able to extend 100 non-congregate beds through the end of this year, working with the state on some CDBG COVID funding. And we got great news that that's all coming forward. We're going to actually get a little bit more money than we were expecting. So we should be able to do that we're working with through that process right now to figure that out. So we're just happy to report that we're having a great time working with the state to get funding and keeping it on the timeline. So that also will be coming before you.
And on that note, the RFPs related to the 2 shelter sites, what is the status of that?
Yep, we're in confidential negotiations on both the congregate and the non-congregate. So yeah.
So you'll have an update hopefully
Yep.
soon on that. Right. Thanks.
Yep. Okie doke. So can we share the presentation? Or do you want me to click through or? Okay. Just undo this one right here. Move. Okey-doke. Okay, great. So I want to share with you a project that we've been working on. This is actually not a new idea. It's an idea that's been percolating for a long time. Randy Solt, who used to be the co-chair of this was a interest of his, so I'm excited that we're moving forward with this. And part of the reason we're bringing it to the committee today is because on June 10th, right, Kim? We hope so. You will be getting a request to appropriate some funding for this project. So wanted to give you kind of the full overview of the project before you get that funding request. Okay, and can we go down? Great. Okay, so this is part of our overall strategy. And I will explain how it fits as we go forward. But just remembering our big picture goals are fewer people sleeping outside, having year-round shelter, a lot more housing, better access to crisis care, and then showing our impact through data funding and partnerships. And maybe I wonder if I can stop that from happening. Oh, okay, so I don't get too many more emails. Okay, so this is really bringing 2 what I think are good ideas together into one project. One is using micro units. So the picture here is from In Our Backyard, which I think all of you are very familiar with. This is a project that was moved forward by a group from Central Lutheran last year, and the Assembly and the municipality worked with them to make some changes to code to make it possible to do this type of micro unit here in Anchorage. So that's kind of the physical part of the project. And then the program part is using what's called a model, which are called recovery residences. So I'll explain a little bit more what that means as well. The problem we're really trying to address is that we have an urgent need, I think as we're all aware, to add safe and stable units where people can access treatment and recovery services to address substance use disorder alongside getting, that kind of quick entry into some safe and stable housing. So our project is to develop 24 micro units that will operate as recovery residences. This is a national best practice, and it provides transitional living, access to treatment, and recovery supports. So our goals is to pilot this over a 2-year period. We want to do 24 units, use the recovery residence model, and try it out for 2 years starting this fall. We want to create immediate access to those services. And then a big part of this project is really to test and demonstrate the feasibility of using micro units, both for recovery residences, but also for other purposes. So there's lots of different ways that these type of units could be used. So we want to kind of launch this and show that it can work, kind of demonstrate the costs and the benefits, and then hopefully other folks will take it on and run with it. So first off, what do we mean by a micro unit? These are small structures. They provide about 80 to 100 square feet of interior space. And what we've heard from the folks that live in our backyard units is that those are a little bit too small. They're a little too micro. So we're probably more on the 100 square foot end. But they're single occupancy. They're designed for quick construction. So the in our backyard units, they were able to construct them in a week with volunteer labor. That's how quickly they were able to put those up. But they're also designed for year-round habitation, which is obviously very important here, and that they can be relocated easily. We want them to be safe and secure. There's lots of different ways we can do this. They can be constructed on-site. They can be constructed off-site and moved on-site. There's a company in town that's doing conversion of shipping containers and connexes, so that's another option. You can also purchase these and assemble them. So there's lots of different ways this could happen. And inside, you just basically have the basics for one person. So it's a bed, some storage, a fridge, a microwave, a window, hopefully a little desk or, a bedside lamp, that type of thing. In the location, we want to make sure there's good common space. So there will be a separate unit that will have toilets, showers, maybe laundry. That's a kind of maybe. We'll also have a separate space that's a common area with some office space and group space. One thing we heard from the folks that live in our backyard, it's really important that the area be fenced. And they actually suggested that an 8-foot fence is really necessary. They have a 6-foot fence and they said they wish it was 8 feet. And they also put in that privacy screening and they said that really has helped a lot. Having a place where you can gather outside is really nice and important. Pets, as we all know, is a big reason that oftentimes people don't want to go into shelter. And so having a space where pets can live, and in our backyard right now, they have a really wonderful dog that lives there. They call him both the therapy dog and the guard dog and just the dog. So having a pet area is really important. Vehicle parking, we've just learned how important that is at shelter, that people be able to bring their vehicles. And then, of course, there's always a need for storage. So those are some of the things that will also be included. Does anybody want to ask any questions about the units or the location, the sort of common area before I go on to the program model?
Well, just that, and you remember getting to this, that is the intent that another organization would manage this, or that the city would?
Okay, I'm getting to that.
Yeah.
Great. Okay, so then what's a recovery residence? There's a whole range of housing options that support people when they're accessing treatment for a substance use disorder or other kinds of recovery supports. This is designed to be a very low barrier way of helping people get into treatment, especially when they're experiencing homelessness. So it provides some safe and stable housing alongside access to treatment. So this would be operated as a program. The project we're proposing today is not housing and then treatment comes alongside. It would actually be operated as a program, as a recovery residence. So these are operating successfully in Wasilla and Fairbanks right now. True North Recovery operates them. And really the difference between being in a program and being in housing is partly that in order to remain there, you would have to remain compliant with the program. So, there would be rules associated with that if you didn't comply with that, and obviously it's not like, first strike, you're out. But if you're not engaged in the program, then you wouldn't still be remaining in the residence. And as I said earlier, micro units can be used for in lots of different ways. But the project we're proposing is that they would be used for recovery residences. One of the things that's really great about this program model is that these services are billable services for a community behavioral health provider. And so the other examples that are happening in Fairbanks and Wasilla, those are not grant funded. They're funded through billable services. So our goal with this project is to demonstrate that is a good sustainability option. And some of the services that are provided in a recovery residence, there's a huge element of peer support and peer engagement. So there's peers coming in and out of the community all the time and engaging with people, helping them kind of set goals and move through those goals. Case management to help them, do all the things that you need to do in terms of getting ID, signed up for benefits, get employment, all of those types of things. And then also assessment for your treatment needs, and then engagement with outpatient treatment. And all of that is facilitated by that peer support.
Question for you, Mr. Johnson.
Yeah, thank you. We said these are billable services. You mean Medicaid?
Yep.
Okay. And I'm guessing that just is for the services themselves, right? There's nothing associated with the capital costs of setting it up or the operation of the physical infrastructure? Or am I wrong?
Yeah, I mean, I think, so for example, the project in Wasilla that True North Recovery operates, they do that in leased units, some of them. So the amount of billable revenue that you can generate does help cover the costs of the operating the units and supporting, the living expenses. I'm getting there in a second, but we would be offering some startup funding. So that's part of the sort of pilot that we would be testing is if we do some startup funding, then can it operate on its own successfully after that?
Okay, so initially we'd be providing the startup costs and then we'll be hopefully self-sustaining.
That's the goal.
I like it.
Yeah. And that's partly why the micro units are a good option because, once they're built, pretty low operating costs compared to like running an apartment building.
I have another question for you, Mr. Constant.
Thank you. So that actually raises a question about ownership. So if we're funding these and they're going on third-party properties or muni properties, will we ultimately be the owner who is responsible for the major maintenance and upkeep of these things? Or because what I just heard was no, we're looking to hand them off and startup money and good luck with your operation.
So I am going to get there, but the short story there is that the operator for the recovery residence would be a contractor that is overseen and procured by the health department. And then the units and the site would be constructed and developed we're proposing Anchorage Community Development Authority. And then they would have a agreement to basically manage the site and do kind of the property management for the period of the pilot project. And then we could decide after that how we wanted to proceed from there. So the operator of the program and the property manager would be separate entities.
Mr. Constant, did that answer your question?
But if it's ACDA, ultimately it's us. And there are a lot of questions there. You said you're going to get there, so I can hold for now.
Okay. Yeah, let me know if I don't get there.
Okay, I don't see any other questions. Go ahead.
Okay, so where did this idea come from? So back in 2023, the Assembly authorized two different task forces, the sanctioned camping one and the complex behavioral health one. They both kind of came up with some version of this idea. So using different types of small structures on publicly owned locations so that we can provide that immediate access to year-round stabilization. And then specifically the complex behavioral health task force really prioritize people who are experiencing both homelessness and behavioral health conditions, and just noted that sometimes when somebody's experiencing that, it's actually really pretty hard for them to go into like a congregate shelter or other locations where there's a lot of noise and stimulus. There's a lot of folks that are going to be happier to go into a micro unit than into some of our other options. So this is a way of creating another opportunity for people to choose. And then in 2024, again, you all worked to make the code changes that were necessary to allow micro units to be built and used here in Anchorage. And then the mayor also included exploring this as part of her strategy. And then over the course of the winter and into this year, we've been doing a lot of research. So we've learned from a lot of other folks who are using this model. I'm going to share a little bit more about some of the other things that we've been doing. And then we've also been engaging just locally with designers, construction professionals, unions to kind of talk about how this would be like sort of optimally how we would develop this project, as well as looking into sites and all of the ins and outs of which municipal sites we potentially could use. So some of the similar projects I've mentioned, True North, operating the recovery residences, and of course we've all enjoyed the success of In Our Backyard. Some other ones that we've learned from, in Atlanta, there's a project called The Melody, and we actually just had the opportunity to go and visit that. We had Jed Drolet from the health department and Danielle McKenna Foster from planning went. I was supposed to go, but I had a family issue come up. I couldn't go. But the mayor of Atlanta used this strategy to, as part of rapidly housing 500 people who are unsheltered. And they're using shipping container conversions on a city block. And theirs is really for, I don't know if they would call it permanent housing, but it is really more of a housing program. It's not a recovery residence like we're proposing. Pallet shelters, I think many of you are familiar with. Those are ones you can kind of buy off the shelf. They're great and could be here in 2 weeks, and the price point is similar to the other price points. The only negative feedback we've heard about that is that they're just a little bit more kind of institutional, not as homey. So for folks who were living in our backyard, they were kind of like, yeah, this is nicer. And then in Corvallis, there's a really great organization that is doing this in many different church parking lots. So I think they're up to like 30, 40 units, but on multiple different sites around their community. And basically they just ask the church to host the site, and then they locate the units and do all of the interaction with the residents. And the church is just there to kind of host the site. So that's another option. They don't do, one of the things that interesting about their project is they do the micro units, and I think they have toilet facilities there, but for all of like showers, laundry, common area, they do that in one central location. So they kind of have the micro units spread around town, and then they have those services that people need in one location. So that's a little bit different than how we're thinking about it. And they're just continuing to expand and expand. It's working really well for them.
I do have a question for you. Just generally what you learned, how long are people in these units, in the recovery units, generally from what you've seen?
Yeah, the ones that are that True North Recovery is hosting in the Valley and in Fairbanks, they're obviously not in micro units. They're in just apartments and houses. They see people staying between 6 and 9 months. And then for some of these other examples, like I said, some of them are intended more for long-term stay, so a little bit different than what we're proposing. And In Our Backyard, I think they were also thinking between 6 and 12 months would be when people would stay there.
Ms. Silvers?
Didn't the assembly pass an ordinance that would allow churches to put some number of these small units on their property? I'm not sure that anybody except for the one church can come up on that.
So I was remarking that the assembly passed an ordinance, I believe, in the past that would allow churches to put some number of these small units on their properties. And one church, I believe, took them up on that, but I think it's only been one. And so do you have any ideas why, like, that seems to be working so well in Corvallis, but churches aren't really taking them up on it, or us up on that opportunity here?
Through the chair. So I think what they do in Corvallis is they have an organization that is basically taking responsibility for serving the people that are living in the units. And so the ask of the church is fairly simple. It's like, let us use your space, and we will make sure that these are good neighbors for you. In Our Backyard here in Anchorage, similar situation where an organization formed out of their church congregation, and they're really managing the units and again, kind of taking responsibility for working with the people who live there. So that's kind of, a little bit where we're headed with this, is we would love to create this, kind of movement where people do see like, yeah, I could do that in my property, and here's what I would need from an organization, but I'd be willing to do this piece. I mean, that's kind of where we're going. So this is Jed presenting at the trip in Atlanta earlier this month. This is part of the Bloomberg Cities Idea Exchange. And we're hoping that when we get our project up and rolling, that we can invite the mayor from Atlanta here to see it and just keep working together. So this was a really awesome event where they got to learn about the project, the Melody. And then we have this whole kind of project plan that we have a coach that we're working with to complete our project. And good news is we're really a lot further ahead than anyone else. So that's cool. Okay, so where would we put it? This is the $1 million question. We've been going through the map with planning. Lance Wilbur and Tiffany are really helping us trying to figure out where good locations are. And of course, we ideally would like to have a space that's already has, paved and is close to utility connections. That's one of the things that happened within our backyard that was a big cost for them, is they had to do a new electrical connection. And they're not connected to sewer yet. They might become there, but we would like to be. So we've been looking for good sites. We have a location that's near the Tozier Track. Tozier Track is owned by HLB. This is actually in a space that is now right-of-way. It didn't used to be, but they put a right-of-way in it. It's already fenced. It's got some of our kind of junk vehicles in it right now. That seems to be our most promising spot, but we don't have that nailed down yet. And then in our RFP process, we'll also be looking for community partners who maybe want to bring a site to the project. So that's another option that we might find. And then we've looked at a bunch of other ones, but this one's the most promising so far.
Would you imagine that if a community partner were to allow the project to use their space and we're billing for that, you mentioned before that some of the projects you've seen, that the billing is able to not just cover the recovery costs, but possibly some of the sort of costs related to the facility, that there might be an opportunity for some of the cost of the organizations that are allowing us to use or allowing the program to use their space, so that you would see a mutual benefit there of some type to help cover the cost?
I mean, I think if a bidder is going to put that forward in their proposal, that they're going to offer a site and they want to say how much they would need to be paid for it, that would just be part of the bid.
Okay.
And then we'd have to see if that worked.
And you could imagine that there would likely be a similar model where there would be somebody who would be sort of maintaining the physical sort of space there, but then there would be the recovery program that would be coming to and then providing that program.
Exactly.
Thanks.
Yeah. Okay. How will we pay for this? So this is what's going to be coming before you in June. The municipality has a portion of the opioid settlement fund. So these are funds that many states banded together to sue the manufacturers of some opioid medication that have been that were advertised as not addictive, and clearly that turned out not to be the case. And so we have a settlement. We have right now about $2.4 million in our account that's accrued from the initial settlement, and then there's a small amount that comes in every year. So we have the health department's been leading a process for the last, I think, couple of years. Yep. Of like looking through all of the allowed uses for these funds, which are specified in the settlement agreement, and then kind of, parsing that through our community needs. So what will be coming before you, it will be a couple other requests from the health department for some different projects. And then you'll also see this one. So what we're hoping that you will allow us to use is $500,000 that will help us procure the operator for the recovery residences and get that started. And then about 1.2 million, and I say about because we are going to go through an RFP process so that we'll know the exact amount that would go to ACDA so they could run the RFP process, and that would allow us to purchase or build the units and do the site development costs and put the common buildings in place as well.
Mr. Johnson.
Just want to double check my math here. So you're saying, and I understand RFP process, but $1.2 million for 24 units to have them built and connected to services and all that. I mean, that's about $50,000 a pop, which is
47,000.
yeah,
Yeah.
pretty good value.
And that
proposition.
includes the common areas as well. So that includes like the toilet block. Here, I'll show you. Oh, yeah. So that's kind of my rough math. About 20,000 a unit for the micro units. And that number seems to be pretty consistent. Like that's close to what In Our Backyard paid. That's close to the shipping container conversion. That's close to the pallet shelters. So that seems a pretty good number. Utility connections, again, that's going to depend on the site, but that was a hefty price tag for In Our Backyard. Fencing's important. Toilet shower block. The health department actually did a bunch of research to figure out how much those cost. So that I think that's a pretty good number. And then we need a common area office, which guess what, guys, could be an ASD portable. We could find a way to use that. And then site development and landscaping. That's just a ballpark for, and then contingency. So I don't know, but around 1 to 1.2 million.
Yes, Mr. Volant.
Thank you. I was actually going to bring up the ASD portables because there was a conversation that happened where ASD was willing to give us a bunch of them and maybe varying states of repair or
Yeah.
disrepair. But is that still part of this conversation?
I think it totally could be. I think they're not really good for habitation. But I think they totally could be good for like a common area office, that type of thing. Yeah.
Okay, great. And then I guess, I don't know if we want to fully dive into this now, but looking at these numbers, I guess I'm just kind of curious about the pros and cons of this model, which I think is really interesting. And it is certainly interesting to look at the other examples that folks are doing. But how does this compare to if we were just to buy a building for that had roughly 25 units? I guess what are the pros and cons there, both in terms of cost, but also it being able to be permanently used, not having to do the site prep or utility connections, taking into account winter conditions as well. I guess that's just kind of where my head's at.
Yeah. Through the chair, I don't think those are either or things. I think it's really both. I mean, I think the hotel conversions we've done are awesome. Should we do more of them? Yes. Oh, P.S. The COC builds notice of funding opportunity just came back. So that everyone, I think the coalition and a few others were ready to put a proposal in, and it got it just got disappeared when the new administration came in. It's just come back. So that's exciting. They've also increased the funding amount a little bit. So, but that's a good example. So that one was to do a hotel conversion. I think if memory serves, maybe 40, was going to be about 40 beds. And I think they were asking for $5 million to do the purchase plus the renovation. And then you get, your own bathroom and, it's fancier than a micro unit, but it is more expensive. So I just think it's both. I mean, I think the advantage of this is they can be done quickly. They could be located in different places. They can be scaled. But they're still kind of nice and safe and secure. Yeah.
And I want to probably wrap up fairly soon.
Oh, okay.
So you can get through this, but I have
Sorry.
one more question from Miss Silvers.
Yeah, in that site that you're putting up, would you consider, or would it be useful to put enough showers and common space there so that if you wanted to go with that model where some churches offered land for more of these micro units, they could go there to use the common spaces?
It's a nice idea. I kind of doubt that we're going to be able to buy a toilet shower trailer that will have like extra capacity. You know what I mean? But I do think it's a really valid question. Like we certainly need more of that. At Third Avenue Navigation, they do have shower facilities there. But yeah, I think it's an important need. I don't know if we can totally meet it at this location, but it's a good thing to keep in mind. Yep.
Thank you.
Okay. We're on a real quick timeline here. Oh, sorry. Go ahead.
Yeah.
Oh. And which I'll just put it out there. This could be unrealistic. That's I am prone to being overly optimistic, but we're just going to give it a whirl. So assuming that you all feel comfortable and want to throw in on this project next month, we are already working on an RFP for the unit construction and site development. We would be working with the ACDA to get that out on the street. Oh, one of the things that was on that earlier slide, but in that RFP, we would want to provide bonus points for things like using apprenticeship labor. I've talked with the Carpenters Union about that. A few other things. Anyway, sorry, I won't go into that detail because I know you want me to.
Ms.
it.
Baldwin, would you like to ask your question, or do you want to pause to the end?
Yeah, I'll ask now. Based on this turnaround and the fact that Tozier Track is squarely in my district, I believe, and the fact that that property would be very close to a neighborhood that has already experienced quite a bit of challenge with respect to homeless encampment, it feels really important to me that there be some format for community engagement, for a town hall of some sort, for questions to be answered, concerns to be heard, those kinds of things, sooner than later. So I just wanted to state that on the record and offer that I would be very interested in partnering with you and whomever else to host those conversations in a really thoughtful way, so that, on a timeline such as this, which is necessarily tight, we do take the time to hear the community and to generate some buy-in.
Yep, that would be great. I would love that. And I think we could do that as soon as we know that that's a viable location. Yeah, which
Great.
we're still kind of working on. Yeah.
Okay. As soon as that determination is made, I would love to know.
Yes. Great thought. And actually, I should just add that in here because that's an important piece of this process. But yeah, so we would hope if we were to meet this, we would have a contractor selected in July and be working August, September to get the site and the units ready, and then be ready to occupy in October. And layered onto that, we would be doing the RFP for the operator. Okay.
Mr. Chair.
Oh, yes, Mr. Constant, didn't see you. Go ahead.
Thanks. I just want to point out for folks, for perspective, that site was for a long time part of what was called the Tudor and Elmore development. And the theory for that whole area was going to be hundreds and hundreds of housing units, a grocery store to end the food desert that exists there, and a visionary improvement for the area. And so this use is what it is. It's a place, it is open land that is open because it was part of a swap to achieve a higher vision. And that, at least insofar as I'm sure Mr. Rivera and I, in our experience here, we still see a vision for that area that actually has a higher and better use than this.
That's good to know. Part of the benefit here is we're talking about a 2-year project that could be relocated. So that is kind of the end of my presentation, is that in terms of the 2-year pilot, we'd have the health department overseeing the operator. We would have ACDA have some type of a lease or a permit to manage the property and make sure that we're keeping the units up. And then at the end of that period, we'd have a lot of choices. We could either extend it in that location, we could move the whole thing somewhere else. We could also kind of disband it and sell the units and put the money back in the settlement fund. So I think we have choices after that 2-year period.
And so it's interesting you mentioned the health department. The health department was intended to move to that area. And so I think the administration would be wise in its concept of 10,000 homes to also at the same time be looking at that area as an opportunity for permanent housing development and neighborhood support, so that the neighbors don't find themselves at the dark end of a plan that becomes a permanent use instead of the vision that could actually fill that area.
Thank you, Mr. Constant. Any other questions before we end the presentation? Yes, Ms. Baldwin-Day.
With apologies, because I know we are tight on time. Something that you said during this presentation actually flagged something for me in the designated parking conversation. And I wanted to circle back. So one of the requirements for participation in the designated parking is going to be having a license and registration. Did I hear that correctly? I am curious whether that might become a very real barrier for some folks. And I'm interested in hearing whether there's any plan or option to potentially use that designated parking option, like opportunity, as a way to actually help people get a license or get registration for their vehicle. I don't know what sort of triage or interdepartmental work would need to happen in order to make that possible. But based on my own professional experience, people getting identification can often be very challenging. And I would hate for people who really need a designated parking to miss out on that opportunity because they did not meet that threshold. That feels like a potential barrier, and turning people away from designated parking also feels like not what we really want to have happen in this situation. So I'm wondering if there's some flexibility there or an option to adapt the requirements such that people could receive help getting access to those things.
To the chair, I think very important point. We've talked about this a lot. And I think the hard part is the muni can't really oversee parking and allow vehicles that aren't roadworthy, aren't legal for our roads to be there. That said, my understanding so far is that the permitting process is going to happen through the health department. And I think the health department is pretty well resourced to help people, kind of connect with those types of case management or those services that they might need to get their ID. But I do think that's something to be realistic about with designated parking, is it's not going to serve everyone that you see in the community who might be living in their car. It's going to serve people who are living in their car and have a license and registration. So I think that's just something to know about that program. Yeah.
Thank you.
Ms. Brawley, you have a question?
Yeah, thank you. And I appreciate, my questions are similar to Ms. Baldwin Day, but I'm just thinking and I guess this is something that it would be difficult for the muni to officially oversee. Is there going to be kind of more informal setups, such as, you're not going to get towed if you're in this location, right? Because I guess I'm thinking, like, how can we accommodate, because the alternative is people will park in residential neighborhoods. All of us have heard complaints about that, and understood that not all the vehicles can move. But I'm just wondering, kind of, what's maybe the step below that? And I know that, again, that's tricky for the muni to officially make decisions on, but I think practically speaking, if there's ways that we can kind of let folks know where is better or worse to go, I think that would be helpful. So I'm just wondering kind of how that discussion has been, or if there's options there, or if there's some private party who's willing to step up in that regard. Thanks.
Yeah, through the chair, I think I want to delay detailed questions about designated parking until we have the RFP ready, because I think some of this stuff will be answered there. But I think the answer to the second part of your question, Member Brawley, is that, and this is what we've been saying all winter, is that please come to shelter, please come to warming with your car. So you can park in the parking lot and we won't be necessarily checking. And we want you to come inside where you can be warm and not freeze to death.
Great.
Yeah, thanks. And then just one quick follow-up too. So recognizing that folks have, especially if they're working, they might have different schedules, or they might work multiple jobs such that they're coming and going in, what we would consider odd hours. In the RFP, do you anticipate having really strict, like, you're in by this time, or is there going to be understanding that people might have shift considerations?
I will just make note of that and feed that into the process. It's a good question.
Okay, thanks.
Anything else you'd like to close with?
Only just a reminder that we rehabbed the Turning the Tide website. So there's lots of good information on there in connection to other information that you might want.
Okay, and you anticipate something to coming for us in June?
Yep.
Okay, thank you. Thank you for the presentation.
Thank you for all the time.
Could we potentially get a copy of that presentation if we don't
It's
have it
already.
Oh, great. Thank you.
Yep. You already have.
Okay, we're going to move on to our next item on the agenda, which is a discussion around shelter licensing. There was an item before us a couple of meetings ago It's AM 346/2025, related to approval of a 3-year shelter license for the Rescue Gospel Mission, Brother Francis Shelter, Clare House, Complex Care, and Covenant House. So this was delayed and asked to be brought to this committee to have a more in-depth presentation on shelter licensing so we can understand it. It's sort of why we have it and how it came to be. And then specifically, there were questions around the requirements related to it and how these licensees, met those. So we asked for that presentation, and that's why you're here today. So if you'd like to introduce yourself for the record, and you can begin.
Perfect. Thank you so much. Kimberly Rash, Anchorage Health Department. Let me just get a little organized. All right. So today I'm going to take everyone on a journey, a very short journey that is on shelter licensing. So as Assemblymember Perez Verdia has mentioned, this presentation came at the request of the Assembly. So that we can kind of dive into kind of the history of shelter licensing, especially for the new members, and then how we got to where we are today with this document that you have in front of you.
Am I correct? These are the first ones to be granted the license, right?
Yes, this is the first batch that we have done, and I can kind of go into what happened there as well. All right, so the timeline on June 22nd, 2021, AO 2021-55S1 passed the Assembly. Really what this document or this ordinance outlined the code parameters for the health department to implement shelter and transient licensing. So pretty much it provided a framework for the health department to work on this, giving us the deadline that as of January 1st of 2023, we would have shelter licenses enacted. However, that did not occur. In 2021, the health department was still actively engaged in the pandemic. In 2022, there was a lot of staffing transition in the entire health department. And so we were unable to meet that deadline. However, in January 2023, we were able to put together some documents and hand out some provisional licenses. So those were issued on the basis of, here's some framework, here are the criterias. We know that you have to be licensed. And so that is sort of the framework of those provisional licenses that were issued. In 2023 to 2024, we had a complete turnover of staffing within a specific division, the Housing Services Division, and specifically the Housing and Homelessness Services. And so all work on this was stalled, and all focus went to sheltering at that time, so congregate and non-congregate sheltering. In May of 2024, we were completely staffed again within the Housing and Homelessness Services team, and they began working on implementing and picking up the pieces from when the prior team had put together the paperwork on shelter licensing. And so from May to September, they worked very hard and were under a lot of pressure and timeline to get this done because we were so behind. However, in September of 2024, we did send out the letters to shelter operators regarding licensing, and our first applications were received in October of 2024. As of March of 2025, shelter licenses that were received were completed and sent to the body, which is that document that you all received at the April 22nd Assembly meeting. This right here is a snippet of AO 2021-55S1, which I mentioned goes into detail and outlines the requirements of the health department in regards to shelter licensing. This was new. This was a new requirement that was added into code. And so the health department had to take this framework in code and create the entire process from start to finish. And so I can kind of go over some of this processes with you. One of the first pieces that was required of the health department is that we needed to become a local agency security officer. So we had to become a LASO. Part of that process, we have 2 designated members within the Housing and Homelessness team, which are those officers. They are the only staff approved to handle the fingerprints and review the contents of the background reports, and I'll go into a little bit of that later on in the presentation. After that process was completed, we were required to complete a CJIS training, so that is the Criminal Justice Information System training. In addition to that, at the same time, we were requested by the Department of Public Safety to go through an audit. At that time, we didn't have any background checks or any information that we contained, so that we had no deficiencies and we were 100% in compliance. And really what we focused on in that audit was, do we have all the steps in place in order to receive background checks information? And that is something that was confirmed, that we did have all of those processes in place. The next step in the process is that we needed staff to be trained in code enforcement. We need them to be able to enforce this section of code that was added. So staff completed the code enforcement officer training in accordance with the MOA guidelines, which included listening to hearings, administrative hearings, and they were also sworn in by the Office of the Municipal Attorney and designated to enforce 16.120 and 16.125. So high level, this right here talks about our processes and our collaboration. So again, we were required to work with the outline that was written into code. We sought guidance from our childcare licensing. Again, this was something entirely new to the health department, however, not new to other sections within our department. And so we really relied on other sections, and the most applicable was our childcare licensing team. And so they assisted the team in becoming code enforcement officers. They answered questions about inspections, what that looked like, how we put together paperwork. We also collaborated with the fire department, risk management, and land use enforcement to establish processes and expectations for licensing. And all of that went into the final product of how we got to where we are today. And I'll go over that in a couple of slides. Part of the implementation process of putting this here in front of you today was that we needed to go through and review our application. So we had to not only review it, we created an application for entities to use. We performed test runs because we put it online, trying to make it as easy as possible. We updated forms and documents. We prepared licensing letters in coordination with myself. We sent the certified letters and emails to each of the shelter organizations needing a license, and then we followed up with them throughout the process. This is just an example here, and I know it's kind of hard, probably very hard to see on your tiny slide deck there, but this is a example of the letter that we send to a shelter operator. And what it says, it just goes over the need to be licensed, and it goes over the step-by-step process for that. All right, so when an operator is deemed needing to be licensed, and in code, there are certain entities that are excluded. So in section 16.125.010, the excluded facilities are an assisted living facility, correctional community residential center, habilitative care facility, and those that are defined under Title 21. And it goes into that section. An emergency shelter operated for the purposes of housing 8 or fewer persons, not including on-site residential staff, for purposes of sheltering victims of domestic violence or other crimes for immediate safety and well-being. And then any emergency shelter operating only under the authority of Chapter 16.120, which is under the emergency sheltering season. So an applicant would go to our municipal website. They would click on the link to receive the application and go through that application process. We do also offer paper applications. Those are available upon request. And there's a list of documents that are required for the license. And so this right here is just that listing of all the items. Now, all the items apply for every shelter operator, but those shelter operators would click on the links of the items that they need to complete. So what does it look like when the health department receives an application? So the operator has completed their application, submitted the documents online that is received by our team. So they receive that application, they review the documents. So again, high level, a public notice is posted, background checks and inspections are completed. The application is routed to other MOA departments for review. We essentially approve the application if it's in an approvable format. And then it comes to you in the form of an assembly memorandum. Once it is approved by the assembly, it is for a 3-year license. And so while this process has been sort of cumbersome for the team because it was a lot of work, going forward it will not be, because it is every 3 years where we do have to renew those licenses. Fingerprint and background checks. So we've received a lot of questions of like, what does this look like? So part of what is written in code is that operators and managers that are applying for a license are required to submit fingerprints for background checks. And that is why we had to become those LASSOs. The results are mailed to the LASSO, who reviews the background report, or they can check online. If there are no findings on the background report, staff continues with the application process. If there are findings of a barrier crime, the operator or manager may submit a waiver to the health department director. In the items that are listed in the AM that was presented to you on 422, there are no requests for waivers for this section.
I have a question for you.
Yeah.
Oftentimes we find that at shelters it's an advantage to hire people with lived experience, and I would assume that in some cases that this may be a barrier to hiring those folks. Is that true in your experience, and is that why the waiver is there?
That is why the waiver would be there. We have not experienced that so far. The background checks are only for those operators and managers, so the high-level staff within the organization.
I see. Okay.
Not every staff
So
member.
it doesn't require for all staff.
No.
Okay.
So right here just kind of goes over what the barrier crimes are as cited in code. And then it goes into the length of time the barrier crime or condition under bars an individual from the association with the license. So what happens when we receive that application, we review it, we have reviewed the background information. The applicant is requested to contact the fire department for an inspection. The fire department and that applicant work together to get that scheduled, and AFD conducts that fire inspection. If there are any corrections that need to be made, the fire department follows up on that inspection with that operator. Once everything has passed, the reports are submitted to the operator and to the health department as part of our package. On-site visits. So in addition to the fire department's inspection, the health department conducts an on-site visit. So part of the process of putting all of this together in the implementation process is that we needed to put together a checklist. And what we have used is not only things from our child care licensing, also from environmental health inspections for the food aspect, but also what is, safe and sanitary. What does that look like? And so part of that process is that we have to go out to do those inspections, and we ensure that everything is in compliance with the health and safety standards that are listed in 16.125.090.
I know that part of the impetus for this entire thing is the relationship between a shelter and the surrounding community and being good neighbors. Can you talk to us about, in terms of the inspection and the requirements, how that applies to the area surrounding the shelter itself, both maybe the land that they would own or control, and then beyond that? What is the requirement, and what is the sort of what is your role in terms of overseeing that to ensure that they are good neighbors?
Great question. So the part of the application process does require that the shelter operator receive and work with the community, the surrounding community, in a good neighbor policy. We do, part of the application process, put in a sample document if that a shelter does not have one or does not know how to create a good neighbor policy. So there is an example that they can use. As part of the actual inspection that we do on site, and the inspection that AFD does is really for the facility and inside the facility. We don't necessarily mandate what happens outside of the facility, so off their property, but maybe butting up against it. For example, we have gone out and done some inspections and worked with the operators for cleaning up some of the trash on their property. But if it's outside of their property bounds, we try to have them work with their community or whoever's on that other side of that property to work through that process. But all of our inspections really focus on the inside where the individuals are actually sleeping and residing. Next slide. All right. So what is covered in the inspection? And so kind of high level, I've talked about some of the clean and sanitary facilities. There are safe staffing ratios. So these are the ratios that are outlined: 1 to 30 in the day, 1 to 50 at night. And here it's the good neighbor policy and visitor records. We look to make sure that there's smoke detectors, CO2 detectors, fire extinguishers, making sure that where there's toilets, that there's soap, single-use towels, toilet paper, that medication and topical products are properly labeled and stored, and that exits are clear, a dangerous substance are inaccessible, and outlets are covered. Compliance. So again, we do that walkthrough, that on-site walkthrough. If there are areas of non-compliance, we document those and we photograph them for the report. And we create that report and we send it to them. After we complete that inspection, like I mentioned, we give them the report. They have 14 days to comply and remedy, and a reinspection is completed just on those items. If there's areas of noncompliance that are still not corrected after the given deadline, a notice of violation will be issued to them. And then a noncompliance continues, and then the decision to suspend or revoke a license will be made. And we'll follow the administrative hearing under Title 14, which ties back to the beginning of the presentation where I talked about becoming code enforcement officers, and so that they can go through that administrative hearing process. Once there are final approvals, so all inspections have been completed, the final application packet is routed to AFD for sign off. It goes to risk management because within code, it does outline insurance requirements. And then it goes to land use enforcement, so zoning. And then it comes back to us at the health department. Once it is approved, the AM is drafted for the assembly to review, and then a new public notice sign is given. And this is actually an example of the exact one that we have the shelter operators post outside. So the ones that are listed in the AM that was mentioned earlier all have this current public notice posted. So what are some successes and challenges? This was something that was brought up during the discussion of this item, and we wanted to go over what that looks like for both. So we did survey the entities. We didn't receive a lot of information back. However, some of the information that we did receive was that working with us was easy and that we are helpful. The process took too long. And that is a very understandable item because it was new to us trying to implement. And so it was very rocky at times, trying to figure out what do we do here? What do we do there? Let's go back to what we documented in our process. Do we need to update our process? Because when you think of something theoretically and you write it down, it may not work out when you're actually on the ground doing the work. And so we've had some bumps in the way. However, I think moving forward, now that we have a good process that is documented, that has been worked through, I think it will be easier moving forward. What are some successes and challenges on our side at the health department? One of the greatest successes is that we've got to collaborate with different departments across the municipality. We have built working relationships with the shelter operators, and then we've addressed any safety concerns through inspections and site visits. Some of the challenges that we received as employees, as they have received actually as employees, is pushback on licensing. And so the entities are required to pay for the background check fees. And so that was a piece of, why do we have to pay for that? I don't want to pay for that. Why license me now? It's been since 2021. It's been a long time. Why are you doing this now? And so we've had to try to go through those processes with the shelter operators and let them know the struggles that we've been through and why we ended up where we were. There's been some pushback on the inspections, and those are those walkthrough inspections, sometimes feeling invasive. We did receive a question of like, why do you enforce certain requirements? And so some of those certain requirements were making sure that there is an outlet cover on an outlet, making sure that medication is stored. In some locations, there was bottles of medication out. However, there were youth within that same facility. So just making sure that that medication was securely put away so that those individuals don't have access to that. And then just receiving those applications in a timely manner. Sometimes, there's a lot that goes into engaging with the shelter operator through the process. And so sometimes it took a lot longer than what we would have liked for it to have taken. But I think it's just, again, part of the entire process of trying to figure this out and work through it.
So, Ms. Silvers.
Are there any plans in place to address some of these challenges going forward?
Yeah, that's a great question. So right now, it's really about education and working with the shelter providers and trying to work through the process. I think some of the obstacles, like the first one, which is the background checks, I think that is something that we can try to explore moving forward, but it is written in code that we are required that they are required to have those background checks. And so in order for the municipality not to incur those fees, that is a fee that is placed on that shelter operator. And again, everything that is within shelter licensing really focuses on the health and the well-being and the safety of those individuals that are seeking those services, which are our most vulnerable populations.
Ms. Silvers.
I guess if that's true, I don't understand why it doesn't also apply to emergency shelter operators. So it seems like the enforcement on this is just kind of uneven.
Yeah, that's a great question. So currently, right now, we are operating under a Title 16 activation. And so under the activation of there's a lack of shelter space, my activation as the health department director indicates that those entities can continue to operate outside of that emergency cold weather sheltered season. So East 56 is part of the licensing process, so they will be coming up. And I know that there are some other entities that we're still working on for shelter licensing. So what we're trying to do is make sure that all operators that are sheltering individuals fall under this licensing, if that answers the question.
I think what I would like to see at some point, I think what felt missing in the original, and I see on your slides, you're looking at doing an AM. Is that right?
The last slide.
Yeah.
Yeah, because that was a question that was brought up is, do you want to see, so with liquor licenses, my understanding is that the whole entire packet is with it.
Mm-hmm.
And so do you want to see the entire packet of this? Some of the applications are anywhere from 96 pages to 346 pages. So it can be a lot of documents for you, and we're willing to give you all the information you need, or do you just want a cover sheet that looks like this document to work with?
Right.
Whatever.
Yeah,
meets
I mean,
the
I
needs.
think I'd be open to others' thoughts on this. I would like to be able to see sort of the high level and maybe some sub-level criteria for a license, and that they passed this, they passed this, they passed this, they passed that. And if there is for instance, if there is something they didn't pass, but yet they still get the license. Like, is it required every single thing is checked, or is so some type of rubric, some type of form that shows here are the things that are required in order for you to meet the standard, and here's what they met. And so then at least for me, I can go back and if there was any variations or any notes or anything like that, so that then as an assembly member, I could go back and ask, okay, what was that? And so I think we can work this through. There's probably a medium amount of information from my perspective that is not the 100 pages. But for instance, if there was a variance or if there was some exception given to that one, then there's documentation about why. So that's what I was looking for originally was, did they all pass with flying colors and there was no issues at all, or were there some issues in terms of the licensing, and was that corrected, or that sort of thing? So that's I think the level of information that I'm looking for. Yes, Ms. Silvers. And I think I have a couple of people on the phone.
I guess what I would like to see is the whole process simplified. I don't know that we should be asking people for 300 pages to open a shelter in Anchorage. I'm worried about um, what that kind of says to shelters. You know, it says, instead of saying, you want to open a shelter, how can we help? It says, here's all the barriers, here's all the hoops that you have to jump through in order to open up a shelter. And so I think for me, I would really like to see that simplified to something that is like, I don't know, maybe a couple pages of basic information. The neighborhood agreement, I think that that's a good part of that. The capacity limits. But really, I think if somebody wants to open a shelter in Anchorage, asking them for 300 pages of documents before they can do that, I think that's a real problem. And I just want to actually interject in there for a minute and tell you that I really appreciate all the work that you've done. I see all the work that you've done to comply with what the assembly passed. I do think that maybe we need to revisit that and maybe remove some of those requirements that we put into code that are leading to this much work. You know, I noted that we passed the B3 rezone, or the assembly passed the B3 rezone. When I say we, I mean the municipality, in 21, hoping that we could have more shelters in more places. Nobody has started a new shelter since then. Why is that? I've looked at what some of the other locations have done. Houston, that's one big example of a housing first community that's successful. They do not have a shelter licensing program. They have 29 privately owned shelters. And so I just have a lot of concerns with this entire process. And I hate to bring this up after you've gone through all this work. I wish we could have brought it up before you've gone through all this work. But I do think that we need to revisit that. And that's something that I plan to do.
Thank you. And I have a couple of questions on the phone. I just wanted to just interject that during the development of this, because I was on the assembly when this was developed, I had the same kind of concerns just in terms of how much of a barrier this is going to be. One of the things that I would love as we're reviewing this is, and you're doing your surveying, is to what degree does this benefit us, the city, and the neighborhoods around the shelters and the shelters themselves, and at what point is it a barrier? And so I think in any new policy, we put it in place, we implement it, and then we review it and maybe change it in some ways that may be necessary. So just a thought. On the phone, I have first Ms. Brawley and then Mr. Constant.
Yeah, thanks. Just briefly, I hear the concerns about documentation. I think the question is how much of it is sharing what the person already has or what the organization already has, for example, proof of insurance, things like that. I know sometimes 300 pages does sound like a lot, but looking at some of our liquor license, you know, it does add up. So I think there's a way to balance making sure that we're doing that thorough review with, you know, making it streamlined, because I think there's not necessarily a causal relationship between licensing itself and the fact that new shelters don't open. They can't pay for themselves, and so that's the bottom line challenge. But I would also encourage thinking about whatever documentation is required. The long term is really the renewal process. So we're getting these in place now, but like with liquor licenses, for example, again, I wouldn't say that that's like the best model, but they do have a summary form or application, so it covers basically the main questions. One of the biggest questions is going to be, you know, in the liquor licensing world, is violations. I don't know if that's the right word, but really, where were there issues? You know, whether it was with the neighborhood operations, whatever it is. And I think that's when you do renewals, that's where you want to focus. So I would encourage thinking about whatever documentation we're providing. It does matter the new piece of it, but ultimately going forward, every other year, whatever the cycle is going to be a renewal process. So I would plan for the documentation necessary, especially for renewals. Thanks.
Thank you. Mr. Constant?
Thank you. A few thoughts to follow on all of what was just stated. First, a question, Kim, how many staff did you need to hire to implement this section of the code?
None were hired for specifically this code.
Okay, so back when we passed this code, the health department administration told us there's no way we can do this. We're going to need to hire 7 staff full-time to license shelters. So the program at its very beginning was met with such resistance from the bureaucracy that all manner of smokescreens were set up to make it impossible to do. And I'm just glad to hear you say, Kim, you didn't have to hire 7 people to implement the shelter licensing program. That's great news. I think that to speak to Ms. Silver's point about the kind of barriers that might be created by this, actually, I don't necessarily think they were intended as barriers, and we might want to review the process, how it was implemented to remove any unnecessary barriers. But the approach was done for a very specific reason. And the reason was that shelters were being driven into a very narrow section of town, and they were being allowed to operate like the Wild West. And there was no care or concern for how the individuals who were there were impacting the areas around them. And there was no true voice for the neighbors to have a say. And there was no check in place where the local governing body could do anything about the operation. Now, I don't love to quote Mr. Aleva, but if you were to ask him, he would tell you the conditional use process was an absolute failure because you could never get the operators to do anything different. They had the position that they could do whatever they wanted, and they were granted that because, quote, they're serving the most vulnerable. Now, I think that the reality of comparing Houston to Anchorage falls apart every time. They receive $74 million annually to fund their entire continuum of care. $74 million will fund any number of private shelters to operate in their community. We simply don't have those resources. It's really not a fair equivalence. Now, I think in the end, it is fair, again, to look closely at this code, to look how it was implemented, and then to improve it to make it better. But any argument that these systems were set up just to be barriers is not realistic. And when we set out the policy that we would be distributing shelters, we have in fact created a number of new shelters. We have shelters in Spenard. We have shelters in Midtown. We have shelters in downtown now. So East Anchorage is on the list for a place that needs to put up and become a host for a shelter, as is South Anchorage. And that's just the way it works. And I think when those conversations come to those neighborhoods, they're going to really welcome the idea that the Assembly has a clearly established path and the administration has a clearly established process for reviewing and making sure that the operations are going to do no harm to those neighborhoods. And so I think that that's a really important piece to keep in mind as we are engaging in this. I'll just end where I started. Kim, thank you for doing this, and thank you for not making it an absurd act that needed 7 full-time bodies to do. It was never intended to be that, and I do look forward to us making this process more effective and maybe streamlined, but there is a very important reason why this code section was implemented.
Thank you, Mr. Constant. Before we go on, I have a list of people who want to ask questions. How many people in the audience plan to testify today? Can you raise your hand just so I can get a number? 1, 2, any others? 3? Okay. All right. If I can ask for the meeting to be extended by 15 minutes, is there an objection to that? Okay. We'll extend the meeting well, actually, we'll do it until 1:45. I think that we'll make it there. Okay. I have 3 people in the queue. Ms. Baldwin-Day.
Yeah, so first, I appreciate the mammoth undertaking that it is to create an entirely new licensing process from scratch. So appreciation to you and the department for that lift, which is not insignificant. A couple of questions. First, are there any planned follow-up inspections after the original inspection takes place over the course of the 3 years that the license is good?
So after the 3 years, there is a renewal process. And so that is something that we have tentatively mapped out. But in code, it does state that those have to be renewed every 3 years and that there are inspections, again, that are conducted. If in between the 3 years, there is a complaint that is received, we will go out and re-inspect that facility.
Thank you. I'm curious how many applications have been submitted so far versus the number of applications approved?
So those that have been received and approved are the ones listed in this AM. We are working with three others right now. And so those should come forth to the body once we have gone through that entire process.
So 8 applications have been submitted or initiated. 5 of those 8 have been approved.
Correct.
Okay. Thank you. And then lastly, did you notice any common themes, violations, challenges with the facilities or the operations over the course of the licensing process? Just kind of at a 30,000 foot view, not, naming individual operators, but were there things that came forward that were flags?
No, not necessarily anything that was flagged or a theme between all of these operators. I would say that it was a very collaborative process because it was so new to both the operator and the health department that I think just trying to figure out what the process was, that was probably the biggest theme that we found. But there wasn't, operators, 3 of these 5 had XYZ. No, nothing like that.
That's helpful. Thank you.
Ms. Silvers.
I guess I just want to clarify that I do think that the neighborhood agreement piece of this is important, and that's not something that I would like to see go away. I did have a question. So the new shelters that were mentioned that have opened up in various parts of town, have they gone through the licensing process, or will they go through the licensing process?
So any shelter that is not excluded in code has to go through the licensing process. So that, but I don't know any offhand right now. So I'd have to get back to you about that.
So maybe those ones are excluded in code.
I don't know. I'd have to get back to you. Sorry.
Mr. Volant.
Yeah, thank you. So I think something that Mr. Constant said along the lines of, the rationale of taking care of the most vulnerable being sort of used maybe in the past as an excuse to, I don't really know how I want to phrase this, but from my perspective, really what I want to get to, my point is, I think a lot of this does help protect the vulnerable people that are in shelter. I really appreciate the framing of the success and challenges and, where we can look to streamline some of the stuff. I think that is important. But if you're going in and inspecting and you find black mold in a place, well, that's important. That's important to the welfare of those people that would be in shelter. Requiring the disaster plan as part of this, and those those plans can be long, lengthy. That can certainly contribute to a stack of 100 pages, right? But that's important when it comes to what's going to happen. What's going to happen if we have a volcano eruption? Where those, how are those people in shelter going to be taken care of? And so, I think for my part, I really do appreciate a lot of the structure and the requirements, even though to some they might feel onerous. And I do like Member Brawley's suggestion for maybe having a more expeditious renewal process too. So that's my 2 cents. Thanks.
Thanks. Just one addition that I think that what I'm hearing in part is, because this is a new process and sort of pulling out what you learned from that process, and if there are changes that need to be made based on your experience. And so that may be something that would be helpful for you to bring back to this committee is, I can imagine as you were describing it, that you may have set a standard for a shelter, then gone into the shelter and realized that was the wrong standard because of the things you learned from that shelter. And so that learning experience and changes that need to be made so that it really is getting to the purpose of it. And then the other piece I think is just the sort of onerous level that we're talking about here, because I think that as I mentioned, I thought that from the very, very beginning. I don't want to put more barriers onto an organization that we really need desperately. And so that may be information that'd be helpful to come back to the committee with. And that may help, for instance, with Ms. Silvers, if she does plan on moving forward with some actions that reduce things, it would be helpful to be informed by what you've learned. So you like to respond? You can.
Yeah, no, I think that's a great idea. I think definitely coming back to the body with, after we've completed this entire process and kind of getting maybe more in-depth information from the operators, and then coming back. And then if there are any changes, just working with the body through those and making sure that it is aligning with really the health and safety and well-being of the individuals.
Great, thanks. Okay, yes, Ms. Baldwin-Day. Last question.
Thank you. You have hit your quota. In the event that there is, or that someone has a complaint regarding a shelter, where are those complaints filed and how?
It's a great question. So you can go to the Anchorage Health Department website. You can call our main number on our website. Any of those, any emails to the health department, we have a main email address, and then those all get routed to the housing and homelessness team. They document the complaint. They speak with the complainant if there's a name on the complainant to get more information. If not, if it's anonymous and there's enough information to go out, we will go out and do that. Whether it's speaking with the operator and going on site to do a visit, taking any pictures that we need to document any violations, and then following up appropriately after that.
Thank you.
Thanks very much. Yes.
Very briefly, I just want to share that part of the strategy that we're undertaking to move to year-round shelter really rests on this licensing process, because interestingly, and we could talk more about this at another time, as the muni got into 100% funding and operating shelters through contracts, which is what we've been doing for our emergency beds, that really then puts the muni in an operator role. It's very intensive, like the interaction that we have with the operators of, for example, our non-congregate beds in the winter. And if we want to go to a year-round system, we really need to get back into a role of, we help fund this, we help license and oversee it, but we're not like in it at the intensity that we have been. So part of going to year-round shelter and making sure we're supporting a safety net that really works together really rests on this process working well, because that's where we can kind of depend on health and safety standards and not rely on this very intensive contractual relationship that we've been in for our emergency beds. And I can explain more at a different time, but I think this is a really key piece.
Thanks. Yep, go ahead. And we'll begin to set up the chair for public comment, but go ahead.
Sorry. Thank you so much. So for the next steps with this item, it will be back to the body at the next assembly meeting. So what the health department will do is I will include this front page here, I think might be best. And then also maybe put like a matrix or a checklist behind it for each of these entities. Because what I'm hearing is maybe not the entire packet for all of these entities, but just some sort of highlight.
All of these a pass or no pass?
All of those are everything that they have completed and attached. Yeah. So I can kind of figure out what works best there.
I think for reference, it would also be really helpful to see in that, good neighbor agreement MOU, with what entity was that good neighbor agreement signed?
Thank you. Okay. We're gonna, I think we're gonna make it. So let's have the three people who are gonna come up to testify. The first one, come on up. You can sit in this chair right here. And we will begin. And are you able to do the clock up on top? All right. There we go. Share your name for the record and what part of town you live in, and you can begin.
Okay, my name is Ronald Leva. I live in Anchorage, adjacent to the Brother Francis Shelter First of all, I'd like to thank Chris Constant mentioning my name and also saying the challenge that I've had in my entire career being adjacent to the Brother Francis Shelter, which I helped start. So last night's meeting, I hope you all read the packet because it was about licensing and it was about the violations of the Brother Francis Shelter on the conditional use in picking up the garbage. Not done. And then the second thing is the good neighbor policy, which I testified at this committee meeting when another health executive explained that, the licensing, there's no punishment. I said, you might as well use that document as toilet paper. And the good neighbor policy is a memorandum of understanding. It's not legally binding. You can't hold them accountable. Now, the Brother Francis Shelter and the homeless overflow have ruined my business, condemned my land, ruined my family, my marriage, and I'm close to financial ruin. And I brought dominoes here. It's death by 100 or 1,000 cuts. And your approval of giving the Brother Francis Shelter $773,000 for 4 years, give them an automatic license without public testimony. They don't deserve a license. I mean, if you get an application for a marijuana license, it's this thick. If you get a violation, it's this thick, and they fear losing that license. The homeless industrial complex is a money-making machine, whether you're a church or a private entity, and there's no accountability, no transparency. I want to see where the money goes because even the garbage that's theirs, come down today and you'll witness that they didn't even pick up their own garbage. And I have to bring myself, my staff, my clients, my customers to that location, and they're scared to come. I'd rather go to the landfill than go down there. And there's not going to be an area in this town if they have an iota of a IQ over 10 that would welcome any homeless shelter without strict rules and guidelines and punishment if they don't abide. The Brother Francis Shelter, they'll kick out people. Well, how do I know if they're sex offenders, murderers, what they do? We get it all. You get a bad stink from a marijuana grow and you're all over them like stink on poop. This is wrong. It's not fair. It's not just. And I'm going to welcome the dirt nap because I don't think the 1,001 cut is going to be able to lead me to survival.
Thank you. Your time is up. And thank you for your testimony. Appreciate it. No questions. I knew your question.
You jumped the gun on me.
Okay.
Okay,
Next.
Thank you very
next
much.
Up. Sure.
It's a challenging
All right.
issue, but I appreciate your efforts.
Next up, please. Whoever would like to testify next. Okay. If you can state your name for the record and where in town you live, and you'll have 3 minutes. Go ahead.
Yeah, hello. My name is TJ Andrew. Came here to sit and listen. I wasn't expecting to share. I'm representing myself. I am involved with a community council, but I'm here representing myself, speaking for myself. In 2023, I volunteered to participate in the municipality task force. We came up with quite a number of thoughtful recommendations. I am really glad to hear some of these recommendations being talked about and discussed once again, and even being implemented. I know the prior administration, when it came to homelessness, I felt it was stagnant. I do like Mayor LaFrance. As a new mayor, there's a lot being talked about, a lot of planning, and action. I do like the micro units, the expedited timeline. And there's a good possibility that these micro units will be implemented in the fall. I do like Mayor LaFrance's big plan, 10,000 homes in 10 years. I'm glad to see that, but Anchorage is landlocked. To have these homes, there has to be land available. Right now, we are landlocked, so I want everybody just to keep this in mind. Yeah, if we're going to build these homes, where are we going to build them? So I know the Anchorage area has a lot of parkland, a lot, and so does the state. So there has to be maybe a partnership with the state to try to open up more land. So just keep that in mind as well. I do like the community partnerships to possibly help build the micro units. And I know, you know, the families and the homeless women that are on the streets. I've always said that, yeah, we need safe places for, you know, women to sleep. So I like to see the micro units. I don't know if they could be specifically open to women and families, but we need more shelters for Alaska's women and the homeless families. So I'm only aware of the soup kitchen downtown, and from my understanding, there's overflow there, and I'm aware there's a women's shelter in Spenard area, but please keep in mind future women's shelter to be built.
Thank you.
Thank you very
so
much.
for your testimony.
Thank you.
Yep, come on up. And I think we have two more, so we'll extend for these two and then we'll end our meeting. Thanks. State your name for the record and you'll have 3 minutes.
What? I don't get 4. Okay. Jamie Lopez, East Anchorage, formerly Coalition. Is this on? Formerly Homeless. Okay. So when Mr. Constant mentioned the good neighbor policy, I looked at over at 111. It was like, you know, he got a shot of adrenaline and the vigor was going through his system like he was 20 years younger. I looked at him and I was like, oh God. So anyways, yeah, with the apology, I want to start out with an apology. Last month, I came before the committee and, you know, I already apologized to Mr. Martinez privately, also apologized to, you know, Lions Club. Essentially, I brought someone forward. They were not honest with me. And so I may forgive them in time, but I just wanted to say I apologize because typically I look for the best in people. And sometimes I don't look and then I just have to look a little bit after the fact. So Coalition didn't show up. You know, 2 months ago, I brought Neilani forward here and they haven't done anything. And it's one of these things where it is a black mark on the industry, it's a black mark on that organization that they have not tried to make that right. She was promised Project Next Step. She was promised a year of case management and housing, and she has not gotten it. And so, you know, her image is still up. Whether or not they take it down or not, they have promised her something, and they're not delivering. And many funds were used for that. And so I'm hoping somebody here will try to get her to get them to do the right thing because they're not doing it of their own volition. Project Next Step, what happened to it? Where did people go? It was a success, was it a failure? I've seen some at Davis Park. Designated parking, the issue with that obviously sort of been brought up. A lot of people, they have vehicles, it's the last vestiges that they have. Sometimes they're not functioning and running, but it is a place for them to live. And you need to take that into account so that they have the ability to have a place to stay. There was a guy who got abated 7 times. His name's Ron. He was over at 33rd Street. Emily Goody Coons did an article on him. And they stripped his RV and his SUV, the last thing that he had. The Hope Team ladies came out to give him gas, and then apparently the CAP team, Sergeant Hanklin, they towed his vehicle later in the day, and he had heart problems, and he had a birthday, and then 4 days later, it's gone. So let's see what abatements are us. Somebody's still smashing the button, but they don't have places to go, and so you are pressing your luck because literally the one off Lois Drive. They were over right in front of Dempsey Anderson. They had no place to go. There was an abatement there in March. They ended up going right into the right of way. They have no place to go. That abatement happened yesterday. They're right at the church right across the street at the pantry, them volunteering that. No, literally, this is happening all over town, and it makes it look like you're doing something, but you're not. They're denying over at Davis Park. They're about to be abated off their own lands. And not only that, with the policy yesterday, they're about to be criminalized for essentially trying to start a fire to keep themselves warm or to even cook. It's a bit difficult to understand. The last thing I wanted to say, I'll button it up, sir. What is the plan for the people outside? There are hundreds outside right now. And I know there are long-term plans for years down the line when housing is done. The 24 units, micro units, good idea. It's a step in the right direction, but there needs to be support for the hundreds that are outside. And come on, guys, do the right thing, please.
All Thanks very much for your
All right.
testimony. Okay,
Yep.
our last one, come on up. And would you like to speak as well, ma'am? Oh, sure. Yep. You know what? As long as you're here, we might as well, we'll have everybody speak. So you'll be after her. So go ahead. Ma'am, if you can share your name for the record, and then you'll have 3 minutes to speak.
Leona Seal.
Mhm.
I volunteer at Trusted Connections because we haven't had our funding yet. And I see that there was no new funding for no new shelter. And why I'm saying that is there has been these same shelters, these same agencies that are helping the homeless, the addicted, and the vulnerable. And, because I'm Native, I look at the Native statistics because we are just statistics anyway. It's been growing. And even on the youth area, the numbers are going down while the Native keep growing. How many they are, how many they're on drugs, overdoses, deaths, suicide. And you could see it on the web, how, the other nationalities are going down. Why is that? It is because just like Covenant House, I went to the opening, the house opening, and there met all the staff that are paid well, and there was no natives. There was nobody that looked like me to, I'm a native. I despised when I was referred to anywhere else and somebody there talks to me who doesn't know how to be in the village, how to be around all the natives, all the homeless. If you guys want that 300 something page, I have one page for you people that want to go through all that 300 page thing report. One page for you is to do surveys at Brother Francis, whoever you fund, and see that the vulnerable are living in worse than a jail. I know because I have lived experience. I walked the streets, I was homeless, and I lived in the cold center
Mhm.
where I was like, I didn't, I thought they were the police.
Yeah, ma'am, your time is up, but
Oh,
you can,
sorry,
oh, it's okay.
but
You can just
Yeah,
finish your thought.
they need to be checked out.
Okay.
Because there's abuse by staff and they're not there for serving the vulnerable.
Thank you. Then thank you for your testimony. All right, we have one more. Come on up. Come on up. Share your name for the record and, I forgot to ask the other ones.
Thank
And
you
what
for-
area of town you live in, and you'll have 3 minutes.
My name and where I live.
Uh-huh.
My name is Alice Manuelian.
You probably want to push the button right there and it'll turn green. Push, there you go.
My name is Alice Manuelian, and I live in the Spinard area, and I live in District 3. So I think
That's me.
Cameron, you're in District 3, and so is
Anna Brawley.
Anna, right. Okay, so the situation is that I feel that there's some buildings behind my home. One is a burnt down apartment building, and the one next to it is an abandoned building that's boarded up. And they do have abandoned cars in the front. And because of the burned down building, it has attracted some homeless and some activity there with squatting in the cars and also squatting in that boarded up building, which they took down the boards. Each time the police were called, so these are documented. And the other thing is that basically, it's also attracting people in the dumpsters around there, that they're taking the trash when they're looking for food. The trash is going on the ground. And I feel that, well, I don't feel, but other neighbors are dumping in that area. So I didn't know what actually, any action that can be done, but it's getting worse and worse. I'd say within the past week, we've had 3 activities. One person, we saw a fire being started. We didn't see the person. We saw a fire next to that building, that empty building, which was right next to the apartment building that was burnt down. So it's attracting. So my concern is that it's getting worse and worse, and I want things to be prevented. Thank you.
Thanks.
And I was told to email you and Anna on this, but I wasn't sure how this is orchestrated, but I thank you for your time in this.
Yeah, and actually, before you leave, you may want to check with the, she'll be able to connect you with some of the city's homeless services as well, so.
Okay, yeah, that's great. And then I just
Code
wanted to
enforcement, there you
add, I know that we need housing for the homeless and we need shelters, and it's very important, but we need to take care of the basic things like trash and crime too.
Thanks. Thanks
That's
very much.
important. Thank you.
One more person. Okay. All right. I'm afraid we're gonna have to have this be the last one. So let's do that. You'll have 3 minutes for the record. Please share your name.
Thank you. My name is Dawn Morse. I'm in Mountain View, and I have just a brief request. In the licensing program, I read through the list of all of the documents. I didn't see anything there that said, here is what the people that are accessing the shelters think about that shelter. And I think that if serving the most vulnerable in our community is actually what the goal is, which I think it is, hear directly from them what works in that shelter and what doesn't, including some time where the licensing people sit and watch and see, experience what it is that people are living in those shelters. Thank you.
Thanks very much for your testimony. Okay, we're in our meeting. Meeting is adjourned. Thanks, everyone.